listening right now who is saying, okay, so pre-diabetes, diabetes, she still didn't tell me how we diagnose it. How do we diagnose it, Doc?
Okay, so there are three main ways to diagnose diabetes. There's a test called Hemoglobin A1C. It looks at the amount of sugar that's on your red blood cells. It's a test that we perform every 3 months. So it gives us a 3-month working average about what your blood sugars look like. And a normal A1C is when you are 5.6% or lower. To be diagnosed as having diabetes, your number has to be 6.5% or higher. Anything between 5.7% and 6.4% is pre-diabetes. Pre-diabetes means your blood sugars aren't normal, but they're not high enough that you could be classified as having diabetes. So that's the A1C. The second thing that we can do is to do a random blood sugar at any time of the day. A random blood sugar over 200 milligrams per deciliter, that's in the diabetes range. To get it into millimoles per liter, which most of our Caribbean countries use, you divide by 18 to get that number.
So repeat that again. What do you do? What's the factor?
Divide it by 18.
Divide by 18. Okay.
Yes. But my mind is already swapped to this.
So you're saying if somebody has like 600 millimoles per milliliter, divide it by 18 to figure out if it's above 200 milligrams per deciliter?
So if the one has 600 milligrams per deciliter, divide that by 18 to get the millimole per liter.
Oh, okay. Nice. See that? So the factor matters. Okay.
Right.
And so we've talked about A1C.
Random blood sugar.
What is random? Because most people seem to think, you have to be fasting for 12 hours is the only way to know if you're diabetic. What does random mean?
At any time of the day.
Yeah. So even if they have just eaten.
Yes. So if you look at fasting blood sugars for diagnosis, we consider fasting when you haven't had anything to eat besides water for at least 8 hours overnight. And a normal number is when you're less than 100. So 99 and lower is normal. To have diabetes, the number has to be 125 milligrams per deciliter or higher. So anything between 100 and 124, we consider that to be pre-diabetes. And then the last test that a lot of us really don't do anymore is postprandial blood sugars, where we bring you into the office and we give you a sugary drink that has about 75 grams of sugar in it. And then we check your blood sugars 2 hours later. Yeah. So a normal number is when you're less than 140 milligrams per deciliter. So if I don't have diabetes. If I ate a meal and check my blood sugar 2 to 3 hours later, it should be under 140. If you have diabetes, that number is going to be above 200. So anything between 140 and 200, we consider that impaired fasting glucose or pre-diabetes.
Yeah. So impaired means the body isn't breaking down. It's not using sugar the way it's supposed to, correct?
Yeah.
And so does pre-diabetes mean that someone is on their way to diabetes?
Definitely. Pre-diabetes is one of the number one risk factors for you to develop into full-blown diabetes, but it doesn't have to be that way.
Right. And we'll talk about that, won't we?